Hello and welcome to another episode of Real Talk on Renal Cancer. My name is Laura Esfeller. This is a podcast from the G. Nicholson Kidney Cancer Foundation, and we are so grateful for the support we receive from Merck. And I am really excited to have today Dr. Adam Stern joining the podcast. Adam and I have known each other for a few years now, and Adam, your story is incredibly interesting and inspiring, and welcome to the podcast.
Thanks, Laura. It's good to see you, and thanks for having me on.
Thank you for having. Thanks for coming. Dr. Stern, if you want to maybe share with us what's your connection to kidney cancer?
Yeah, I'm a rare case in that I was a physician before I was ever a patient, but I am living with kidney cancer over the last 7 years. So I was 33 years old on the younger end of the spectrum, but I think we're seeing that more and more. Younger folks are being diagnosed more and more. And 33 years old, I had a whole life going on. I had a baby at home, just moved into the suburbs, a job as a psychiatrist at Beth Deaconess Medical Center in Boston, and on the faculty at Harvard Medical School, and really just like feeling like my adult life was just getting going. And like a lot of folks had a shock of a diagnosis when it happened. The first 2 years after that were very intense, very involved. We don't have to go into all the details right now on that, certainly. And then I've been very fortunate in the sense of being a long-term survivor with this condition and doing very well. So I've been able to live my life fully alongside the diagnosis, alongside the illness, and it never leaves. But part of, I think, what you're maybe alluding to a little bit in terms of my story is just the things that I've pursued, if not despite the condition, then right alongside it.
Yeah, I really appreciate you sharing that. And I agree. I know we talked before, but I was diagnosed at a similar age to you and felt the same way, right? My career was on the upswing. I just got a promotion at work the year before, and then this thing really blindsides you. And I think no matter your age as a patient or caregiver, it really is something that changes your life. But I'm really curious, you've now experienced medicine from both sides. You're a physician, now a patient. How has this perspective really shaped your understanding of patient care and the doctor-patient relationship?
Yeah, that's a great question. I think that most patients have a nostalgic vision of what their doctors' lives are like and their careers and how they go about their day. And we're coming as patients, you go to your doctor at your worst, right? You go, in the sense, physically, you're the most vulnerable that you've ever been, especially after cancer diagnosis. I think that all of that adds up to a certain expectation. But what I knew from several years of clinical practice and academic research is that the number of pulls and pressures and stressors that are on the physician and all of the other members of the care team, that if you don't advocate for yourself as the patient, no one else is going to advocate for you, in the sense that they are trying to get through their day by helping 20 different people in 1,000 different ways. And all while they're getting emails asking them to do one extra thing, all while they're being pulled in 8 different directions, not even to mention their own lives outside of the office, right? One of the things that I learned in order to be, I don't want to call myself a better patient, but to try to be the best patient I can be, if that's even a phrase, is to make sure that I advocate in the way that I know after the appointment. I'll say, I did bring that up. I did make sure that they knew about this thing that I was worried about. Because if you don't do that, the thing that makes a lot of doctors or other practitioners happiest is when patients are doing well. And if a patient comes in and they don't say that anything's bothering them, or they don't say that, I had a thought about this treatment, what do you think about it? The doctor's not necessarily going to go there, because they're going to say, oh, things are going well, and continue. So that's one lesson that a different perspective that I think I had than a lot of patients.
I think that there is such a thing as being the best patient you can be. And to your point, our oncologists and our care team, they do really care about us. I've been very fortunate that I've always felt that support from my oncology, my surgery team, and everyone else. But to your point, they're seeing so many patients a day, and there's a lot to keep up on, even if they are specialists in the field, which we always encourage patients to see a renal specialist if they can. There's a lot of research to keep on top of, and medications and everything else. And so to your point, it's really important to feel comfortable speaking up. I actually was diagnosed with DVT on a whim, honestly, because
Mm.
it just happened. That's deep vein thrombosis for patients who are and caregivers who aren't aware. But I just casually mentioned to my oncologist in the office one day, I said, got a little bit of like pain behind the back of my knee. And I honestly didn't think much of it. I'd been wearing a lot of high heels at the time. And like, it's probably just like leg pain. And he's, I'm going to go send you for an ultrasound just in case. And thankfully he did because I did have blood clots. So it's just, even if you don't think it's necessarily something incredibly important, I think it's better safe than sorry, I feel like. Don't you agree? That's usually the best philosophy.
Yeah, and there's a corollary with that too, is sometimes I will find myself wanting to drive the boat, so to speak, and be like, I think we should do this, and I think I'm fine. I don't need to get that test done, or I don't need to go to the ER today because and that's another perspective difference from my prior life. Before I was a patient living with cancer, sometimes I would say to patients, you really need to do the X, Y, or Z. It's pretty important. And they'd say, we have this trip planned. It's not a good time to do X, Y, or Z. And I would become very frustrated, right? Because I'm trying to help as a physician. You're trying to help. This is my advice. Do this thing. It's really important. You can do the trip another time. But then when I became a patient, I realized the trip is representative of your whole life. And so sometimes people come and you never know what's important to patients unless you ask them. And patients, your doctors aren't going to know what's important to you unless you say so. And yeah, I can remember specific examples where I've learned the lesson of you are going to see, in my case, a renowned specialist that really knows what he's doing. And when he tells me to do something, even when I'm like, I don't want to go to the ER to have this checked out, I have to listen because it's simultaneously somehow both. You have to be autonomous, maintain your autonomy, your agency, and you have to listen to the experts and you have to listen to your doctors because they are trying to take care of you the best that they can. And they've seen so much more than you have in your N of one case study, which you know yourself better than anyone else, but they know the condition. So it's like those two things together. It's a paradox in some ways.
Yeah, it really speaks to why that partnership between the patient and their doctor is so incredibly important. I'm just curious. I always joke that I wish I would have paid more attention in college biology before diagnosis. And it was intimidating, honestly. I feel a lot of patients feel this way whenever I was diagnosed because I had to learn so much about my disease very quickly and a lot of technical things. I hadn't really thought about my kidneys probably in years before I was diagnosed. And I'm curious for you, since you have this medical background, you're a doctor, how did it inform your approach to your treatment and just navigating the healthcare system? Do you feel like it made things easier for you? Or do you feel like it made things more challenging for you in some ways?
It's definitely a little bit of both because, I can read a synopsis of a clinical trial on clinicaltrials.gov and know that I have a better sense than most people about what that trial is really all about. What are they hoping to prove or disprove? What are they hoping to show or look out for? What are the risks? I think that it gives me a little bit of an edge in terms of things like informed consent because I have a pretty clear-eyed view and experience of what those risks and benefits potentially are. At the same time, it can be a challenge because I am one of these people, this is coming from long before my diagnosis, that just I'm a type A person. I want to be in charge of things and understand everything. And you can never stop. In other words, if your goal is to understand everything, you'll spend your entire life trying to understand everything, especially in the quickly evolving landscape of kidney cancer. Just in the 7 years since I've been diagnosed, the standards of care have changed like 3 different times. It's really incredible. But if you follow all the literature that it takes and all the scientific study that it takes to get from point A to point B, you can get lost in the weeds. And I can tell you also, you can have your heart broken a few times because you think, oh, this thing really holds a lot of potential. If I can just survive another year or two, maybe it'll get to phase 3 and then maybe I can be considered for that trial, or maybe it'll even be approved by the FDA. And if a drug treatment fails in a clinical trial, it's a heartbreaking thing sometimes. I think it's a really wonderful thing that patients are, how do I put it? It's sometimes there's heroism in the academic and scholarly and especially clinical pursuit of better treatments for patients like us. But there's also definitely heroism in the participation in these trials because they are by definition unknowns for patients, and patients are going in not knowing if this is going to lengthen their life, improve their life, lengthen their life, but make it harder, what the costs are associated with, and I don't mean financial, although that exists too, but the psychological and biological costs of trying new treatments. I think I'm off on a tangent there, but definitely it's a complicated topic.
No, I'm enjoying your tangent. So, no, you're right. It's really hard because I've shared before that my mother was diagnosed with kidney cancer about 2 years after my own diagnosis. And I think that was harder in many ways than my own diagnosis. One, because it's just hard watching your parent go through something like that, but also because I knew enough at that point to read her scans with, again, I'm not a doctor. I don't have a formal medical education, but I knew enough at that point to where I could read it without needing it to be interpreted by a professional necessarily. And it was hard because I'm trying to look at it from a clinical perspective of helping her choose the right treatment and being a responsible caregiver, but then also knowing the challenges of her particular case. Yeah, it's hard to balance both, I feel. And yeah, you mentioned, I know you've been through numerous treatments and you've had surgeries and done immunotherapy. And since we're on the topic, do you mind sharing a little bit more about how this emotional roller coaster of living with metastatic cancer and what it's like to undergo different types of treatment? Since we're already talking about those emotional costs, if you will.
Yeah, for sure. You know, it's evolved so much over the years. And again, I think people like you and me, we often very much count ourselves as fortunate because obviously we were very unlucky to have these diagnoses, but we've been in some ways, I'll speak for myself that I've been very lucky and fortunate in how things have just turned and twisted, since the diagnosis. So I was first diagnosed at stage 3 in 2018. By 2019, no, sorry, by November of 2018, it was discovered in my lungs. And then, it's one of those things of like looking back, you could already see it there as tiny little nodules that were indeterminate. So it's essentially stage 4 from the beginning if you look in hindsight. And I've gone through a couple different immunotherapies, and then in that process also went through, I've had my right upper lobe of my lungs removed. I've had multiple different wedge resections and then cryoablations within the lungs. And I came back in the kidney. I've had ablations in my remaining kidney after, of course, having the original left-sided kidney removed. And then the sort of, I know I was about to say like the king of all treatments for me, but only in my traumatized psychology is that the king of all treatments was the IL-2, high dose IL-2 is something that I did, which is very rare these days. Like it's not even available for a lot of people at a lot of locations anymore. And the thing about high dose IL-2 is that it's like very effective in a very small number of patients. There are certain long-term responders that you see. They're out in the world and they introduce themselves on places like on the web where there are support groups, and they'll say, I did high dose IL-2 in the year 2000. And you're like, oh my goodness, this person's still no evidence of disease after all this time. So there was a moment, and I was really on the fence about trying it or not. And my doctor essentially said that you should try it because if you don't, you're always going to wonder how it would be. But it's a very difficult, it's brief. It's only 1 week in the hospital, then a couple weeks at home, then another week in the hospital. But those weeks in the hospital are ICU level of care. And they're like, I would say by far were the most difficult weeks of my life physically. And then emotionally waiting to see how the impact was. And for me, the impact was a mixed result. So some of the masses that I had in my lungs at that time, one shrunk, one stayed the same, and one got bigger. So it was like, okay, this wasn't the solution, but that was in 2019. So that was like 6 years ago, 5 or 6 years ago. And what I can say with pretty good confidence is everything has really slowed dramatically since that moment. in 2019, and it's almost like the dream that people talk about of trying to live with this like a chronic disease, people who are living with diabetes or even HIV, where it was once considered a death sentence and now people's lifespans can be unimpacted. That's almost like the gold standard because it's like a functional cure. If you can say that you're going to imagine a road so far ahead of you that it's going to be decades, then it's as good as a cure in my mind. And IL-2 was one of those forks in the road where I took one path and it wasn't the dream scenario of full remission, of all the masses disappearing and forever being gone out of my life. But still, since that time, things have been a lot better, and I'm just on a completely different track than I seemed to be in the past before that.
Yeah, I don't know that I knew that you did IL-2, and so I appreciate you sharing that because I've heard from other patients that have done IL-2, it is, to your point, brutal. It's not an easy treatment to endure. Not that any of these treatments are necessarily a walk in the park, but it is such a high level of care. And yeah, I can understand why you did that. I think it maybe was still the king of all treatments for you in a way, because it sounds like you've still had some benefit from it. And I like that your doctor said that if you don't do it, you're never going to know. Yeah, I think that's what's so challenging about a cancer diagnosis. And yeah, the treatment landscape, to your point, has changed dramatically since you and I were diagnosed. But there's still a lot of unknowns. And that's one thing that, for me as an advocate, it excites me in a way because I see how relatively fast the field is moving. And we have a lot of incredible doctors and researchers that are on the case and that they're trying to figure out what are those kind of secrets to unlock that we will figure out kidney cancer for the next generation. But there's still so many unknowns. And I think that whenever a treatment opportunity presents itself that you may benefit from, I would probably made the same decision as you, I think, just because.
And that was a moment where I was so paralyzed with indecision because the options were have my third lung surgery in the last 10 months, something like that, and know that I'm running out of lungs for them to cut out, and know that if I chose that path, that it's almost like acknowledge, and this is my own case. I'm only speaking about myself at that time. But if I chose that path, it runs out of the road ends not that far down the road. And but I knew what lung surgery was like. And it's no picnic either, of course, but I knew it was a known commodity and all I'd heard about was how challenging IL-2 was. And it did IL-2, let's not mince words, it and here I am mincing words. I'm trying to say that it wrecked parts of my body, like my heart. I experienced myocarditis with that, which is like an inflammation of your heart muscle tissues. The labs that were coming back were consistent with having a heart attack. I went into VTAC, which is when ER, the TV show ER, when they're like, we needed the paddles, and they didn't need to do that for me because it only lasted for 5 seconds. But it was seriously, incredibly, things were happening to my body that I wasn't even aware of, right? So my renal functioning in that one remaining kidney, just because gets back to your early questioning about what it's like to be a physician with the disease. I was like tracking it in real time, tracking my creatinine go up to 4, which is like needing dialysis. I was checking my electrolytes just be completely absurdly off the charts. And they know that going in, that's going to happen, and they know how to handle it. This is one of the reasons it's not offered in very many locations because A, it's very dangerous while you're getting the treatment done, and B, only a very select few practitioners really know how to manage the severity, the toxicity of the treatment itself. But coming out of it, like you said, I just feel so incredibly fortunate and glad that my doctor nudged me in that direction because I didn't know what to do. And we talk a lot about patient autonomy in the field of medicine as being so important. And in the patient advocacy community, we talk about it all the time as being so important. And also not as important, but in the same plane needs to be the trust in your physician to help guide you and tell you what treatment they think you should do next.
Yeah, I love that you said that. And because I don't know that we talk about that enough, right? I think a lot of patients and caregivers nowadays in particular will research treatments online, which is totally okay. And we encourage patients to be educated and to get it from credible sources. But I hear sometimes, I'm sure you do too, as a patient advocate, I hear frustration sometimes from patients and their caregivers of why isn't my doctor encouraging me to do this particular treatment? Or why can't I just go travel to here and get this done? And I think that there has to be some faith and trust in your relationship with your physician. Now, if you don't feel that comfortable with your doctor, then maybe it's time to look for another opinion. But
Yeah.
I've been incredibly fortunate. I had to switch oncologists, unfortunately, because my previous oncologist is no longer practicing and has passed away. But I've been really fortunate that with both of them, I've always felt very comfortable that if you say I should do this, I will do it. And it's funny because now my oncologist and I work together in different patient advocacy settings. And so sometimes he'll be like, what do you think? And I'm like, I don't you tell me.
Yeah.
Appreciate that you value my opinion, but also
Yeah.
I
Yeah.
trust you, you know. So yeah, I think I think that there is medicine is an art as just as much as it's a science, I guess is the bottom line.
Yeah. There's a reason they call it like practicing medicine,
Yeah,
and
right.
just executing medical plans. It's very much an art. And thinking back to when I haven't mentioned this yet on the podcast, but I left clinical practice in 2023 and I'm in clinical trials now, doing something called pharmacovigilance, which is like maintaining the integrity of clinical trials and keeping subjects safe during the clinical trials. So very different kind of work than I used to do. But when I was in practice with patients, I would often try to get a sense of, did they have an idea? Let's say, because I was a biological psychiatrist, let's say that a patient and I were trying to decide on an antidepressant. There are like 8 different antidepressants that all have equal evidence, right? And I had my favorites that felt comfortable with, that I understood the risk side effect profile because I'd prescribed them so many times. But if a patient knew about one and had a positive relationship with it because their family member had done well with it, or because they had tried it once before and it was helpful for a time, or whatever the case may be, I always found it was like incredibly important to get in, to hear that and weigh that and use that information when making recommendations to patients, because that goes a long way. And it's true that like it can be disconcerting when a doctor says to you, what do you think we should do? But at the same time, they're gathering information that they need about what are your values? What do you know? What are your biases? Where are you coming from based on your lived experience? And then also, how can we align our plan with what you want to get out of this treatment relationship?
Yeah, absolutely. And I also just think what's important to you as a patient changes over time, right? Whenever I was first diagnosed and my disease was so metastatic at that point, I would have probably drank paint then if the doctor would have told me it would work, right? Not recommending paint there as a medical form of treatment. I would have been willing to do pretty much anything. And now it's not that I wouldn't be willing to go back on a systemic treatment if necessary. I absolutely would. But I probably would consider like side effect profile and quality of life and all those things more than I did in the beginning, because it's important to me to still be able to do the things that I want to do. And some side effects profiles are better than others. And I would definitely take a closer look at that if I had to go back on treatment at this point than I did maybe almost 9 years ago. But leads me to my next question for you. I think it's incredible that you've been able to continue working full time and you've pursued a lot of your like passions outside of work and cancer, right? And you even welcomed a new child into your family during your treatment. And so how have you managed all of that? How have you been able to manage balancing all of those aspects while still dealing with a very serious illness?
Yeah, I think anyone who's been through the diagnosis would likely agree that it's a wake-up call. It's a wake-up call for the idea that our time on this planet is short, that important things to you are important and you need to prioritize them, that not everything is guaranteed. And I did start pretty much immediately. We talked earlier about like roller coaster of emotions. In those first like weeks and months, it's like survival mode. And hopefully, in my case, my work was very supportive. My community, family were very supportive. I knew that I could focus on trying to get, and then if you're lucky enough, at a certain point, things progress in the sense of stabilize enough for you to get to that second phase where you realize, in my case, okay, I'm actually healthy enough to go back to work now. Do I want to keep doing the thing I was doing? And so, like at that moment, I switched up, I reprioritized my schedule in terms of, listen, I've been doing X, Y, and Z, and I don't like doing those things. I've been doing them to be a good citizen. Can we think of a way to change my job description so that I do A, B, and C, but not so much X, Y, and Z because I'm not doing that anymore? And it's not always easy. Sometimes you're stuck in a situation. Sometimes the circumstances just aren't there for you to make it happen. But I certainly became brave enough to ask after the diagnosis and not just ask, but say, yeah, I'm not doing X, Y, and Z anymore. Let's talk about what we can do instead. And maybe there wouldn't be something, but that was my threshold for cutting things out of my life really drastically changed for sure. And that led to a tremendous amount of empty space that I was able to fill with passions that were both quixotic and silly and also really important. Like you mentioned, having our second boy, our second child. That was like we had these arbitrary rules in our head about I needed to be stable for a certain amount of time before we could try for a second kid, which was always our goal when we got married, was our plan. And it took a couple of years. My second child was born in late 2020. So it took a couple of years before we found enough stability. And even then, the future's never guaranteed. So there were a lot of very difficult conversations with my wife about this is making the decision to have a second child when you're dealing with an illness like this. It has to be a mutually agreed upon decision. It has to be clear-eyed. You have to understand that the future's not guaranteed, that we don't know what's going to happen. And so now that child is 4 years old, and our firstborn is 8 years old. And if you told me that this would be the life that we'd have in 2025, I wouldn't have even thought that I'd be alive in 2025 if you asked me that in 2018 or 2019. And so trying to predict the future I've learned, one of the real lessons I've learned is that I'll be a terrible prognosticator of my own future health and status and in terms of what my life will look like. So trying to live more in the moment, pursue the things that I'm passionate about, definitely are lessons that I've learned.
Wow, I was getting teary-eyed while you were sharing that because I think it's something that every patient can really relate to. And it's hard to explain that to someone who hasn't gone through a life-threatening illness like cancer. I have people in my life, friends and family who go, "Oh, you're all better now." And I'm like, "Yes, I've been incredibly fortunate to have had the amazing outcome that I've had with treatment, but it's almost miraculous." And so now I'm at the point in my life where I'm so cognizant of how lucky and fortunate I am that I don't want to waste time anymore on things that don't really matter. And I want to make sure that I'm very intentional on how I spend my time and what I'm passionate about. And what I'm passionate about has also changed dramatically. To your point, if you'd have told me before 2016 that I would eventually be involved in patient advocacy for cancer or doing a podcast for kidney cancer, I'd been like, what are you talking about? I purposely avoided math and science classes as much as I could, but I think it's a universal experience that patients go through where you really sit back and reevaluate your life and what's important and really view time differently and be intentional and thoughtful in how you spend whatever time that is that you have. And it's funny because everybody has like everyone, your life can change on a dime, right? But we're just more cognizant of that
Yeah,
patience.
for us, it hit us over the head in a really drastic way. And most people, sometimes I think a lot of people get flashes of it and then forget about it for a little while and go back to their life. And yeah, I just think that it's one of these things where sometimes there can even be a risk of falling back into old habits. The longer that you do well, or the more stable your disease is, the more you're like, I guess I have to just live a normal life again. And then you start living a normal life and you're like noticing some of the drags of normal life. And you're like, that's all right. I'll do that thing. I'll do this thing, even though I don't want. And you have to almost remind yourself sometimes, no, remember how you felt after the diagnosis and you didn't think you had long to live? Like channel that. So I also, I don't know about you, but I definitely sometimes experience a degree of survivor's guilt where there have been so many other advocates and other people that we've just come to meet who have passed away in just the 7 years that I've been living with the disease. And there's no rhyme or reason to why am I healthy right now, doing right now, and why are they passed away? There's no rational explanation. And when I feel that guilt, I try to channel it as best I can. I try to channel it into doing one of two things, either doing something good in the world like advocacy or doing something that's important to me, which is can take any number of forms or shapes, but something that is different because I owe it to people who weren't as lucky. That's how I feel, is even if it's just living my best life and feeling like I'm enjoying my life, I owe even just that much to the people who were given the same diagnosis and had the same treatments and aren't here to do that.
No, I completely agree with you. And I think that's one thing that has actually been harder for me to deal with as time has gone on, oddly enough, or maybe that's why, because I've unfortunately the amount of people that I know that have passed has increased, right? And yeah, it's hard whenever you look at someone that, to your point, has been through similar treatment, similar surgeries, what have you, and it's a coin flip. It's really a coin flip as to whether or not this person responded well. And I always say, like, I carry them with me is the way I look at it. And so I try to remind myself whenever I'm going to different advocacy events or conferences or what have you, that I'm not just representing myself, but I'm representing the patients that I know and love that are no longer with us. But it's hard sometimes too, to your point, because yeah, there's times where I feel like I don't really want to do that, or oh, this is what I'm worried about. I'm like, wow, I'm sure so and so would have really appreciated that this they're what they were dealing with.
Yeah.
Right?
Do you ever like still get frustrated in traffic or like in the parking garage and like someone's going too slow for you or it's too fast or whatever, and you get a little bit of anger and then you're like, just take a step back because it's such a small thing. Uh, yeah, that was easier in the early days to have perspective, and as time has gone on, it's like I have to actually try to catch myself.
Yeah, no, first of all, I live near Los Angeles, so I'm always in traffic.
Even
Traffic. But no, I completely agree with you. Or even just like little things like I something with my kids. Something will happen with one of my kids and I'll get frustrated and I'm like, really? This is what I'm frustrated about with them? Such 6, 7, 8 years ago, I would have been grateful that I'm still here to even be having this argument with my child. So yeah, I do think it's something that, and what's funny about survivor's guilt, I feel, is that there's also the added guilt of you don't want to talk about it because you feel like or I feel at least, gosh, I'm a terrible person for even feeling guilty about this. So
guilt around the guilt.
yeah, I don't know. It is something that, like I said, I don't know that we talk about as much as we should, because I do think that survivorship, look, is a wonderful phrase, and I'm glad that the scientific community is really investigating it and doing more studies around survivorship. But I always get a little, maybe frustrated, it's not the right word, but I always get a little, maybe it is the right word. I get a little frustrated around whenever most of the topics around survivorship are like, oncofertility or,
Right.
right? Look, those things are very
They're
important, not
important. Yeah,
it, right?
but yeah.
But what about all the psychological burdens that you have as a long-term survivor, or even just I was sharing with you before we got started. I have my scans coming up next week, and I don't get as much anxiety that I used to around scans, but because I've been fortunately doing so well, it's almost like that reminder that I'm still a patient living with cancer at the end of the day.
Yeah, it's like a little demon that pops up and I'm still here. Don't forget, you can't forget about me.
Right.
That
Right.
wasn't all just a terrible dream. Like it really is still
Right.
hovering at any moment for you. Yeah. And it's I'm sure scan anxiety, whatever has come up in a lot of your conversations, and it's certainly outside of podcasts as has in my life. But it's one of these things where there's almost a cruelty to the idea that it's scheduled, and like you schedule it. You're like,
Right.
okay, I guess in May or whatever, May 15th, I'll be pretty anxious. All right, and it's like great when you it's people have funny relationships with scans because like sometimes if you're doing well, the doctor will want to spread scans out. And even that makes me feel anxious because I'm like more time between scans.
Right.
Objectively, that's a good thing, right? But
It's so
it's
fair.
scary. Yeah. And if it's like, oh no, we better move that up to 8 weeks instead of 3 months, then you're like terrified about that. So there are so many ways where it's an anxiety provoking thing and it just changes your whole outlook for a period of time leading up to the scan. In that period, one of the worst things that just happens over and over again is right after scans before you get the result. That for me is like the hardest time of the whole ordeal is when you know the scans exist and
Yes.
you just don't have access to the information yet because someone hasn't read it yet. It hasn't been processed.
I don't know that I've put a button on that before, but you were absolutely right. Just realized when you were saying that that is the worst time for me now because one, I'm just like, okay, it's written in stone now, right? Like it is what it is. I can't do anything about it. But it's also for me, I get I have my chart and then that's who my provider uses. And so every buzz notification I
Yeah.
get until I get that one that says test result, I'm like on edge. And
Oh, I will sit in a room and just refresh, like hitting refresh every 10 seconds. And it's not healthy. That's not good.
it's
No, I would
no,
never tell anyone to do that. But that's how maddening it is for
right.
me in that period. And I'm sure for a lot of people, it's wild and terrible.
And I know there's a debate in the medical community about
Yeah.
you allow patients to have that much access to their information? And I have conflicting feelings about it. Like for me, at this point in my diagnosis, my journey, however you want to call it, I want to see, even though I just talked about how anxiety
Hmm.
it is, now I'm on edge until I get that notification about my test results. At the same time, I want to know so that I can make the most out of my time with my physician, right? So I can go into the payment. Okay, if it's not good news, then I at least have an idea of what I want the plan to be before I have the conversation with them. But I've also seen where patients can get anxiety unnecessarily, right? The scan will pick up on something that is not really anything of concern, but the radiologist has to note it and then like spiraling online and in questions and support groups because they're like, what is this? And you're like, you really don't need to worry about that.
Yeah.
But yeah, so it's a double-edged sword. Like I do think your autonomy point, patients deserve the right to have access to all their medical data. But it does cause unnecessary anxiety at times. I don't know what the solution is.
Yeah, I don't have the solution. I totally agree with you as well. Conflicted, and I feel like I have one idea cognitively and another emotionally, or I want one thing to apply to me and the rest like I want to be exceptional and get my scans immediately and know the information. But then more broadly, like I can see the problems that emerge from it. Absolutely.
Yeah. I almost just I always like read the body language too of the tech and I've heard and again, I'm
Oh,
not recommending that anyone do this.
yeah.
Oh, please, please. But I, like whenever they're pulling me out of the machine, I'm like,
Yeah.
Are
because
they?
they were in the room where
Yeah.
the raw data. Now,
Yes.
what's probably the case is they are doing 100 of these a day. They're
Right.
not even they're just like making sure the file is right and getting it uploaded correctly. That sometimes they're seeing the raw data and you wish you could just see it. You
Right.
just wish you could know in that moment because like you said earlier, it's written in stone now. The images exist. But yeah, so you're like reading the tea leaves and trying to see, do they seem like they're hiding something?
Right. Yeah. And it could just be like they're maybe just having
Right.
something happen outside of work entirely. But I'll be like, do they seem
Yeah.
as cheery as they were when they brought me in? Or do they seem a little bit more reserved? Or can you like wink once? Like
Yeah.
I remember I had one time after a scan, this was years ago, like the text said something like, make sure that you follow up with your doctor within the next like week or something like that. And I was on edge,
Yeah.
my appointment. And it was like my scan was fine. And I think she just was trying to like just make sure I didn't just walk out into the world and not follow up.
Yeah.
Although who does that as a cancer patient? But yeah, but it you know, I guess I caused my own anxiety, like going, why did she say that? Did she see something that
Absolutely. Yeah. The flip side of that coin is just that sometimes my warmest interactions have been with those techs that do the scans or staff that I wouldn't necessarily associate as being, they're not the oncologist or they're not the decision maker, whatever it might be. Like little kindnesses from those individuals like really go a long way. And simultaneously, one of the things that makes me lose it a little bit is like when you're like waiting for a scan to happen, you're waiting for a procedure to happen, you're waiting to receive this potentially life-saving thing into your veins, whatever it might be. If someone's like making small talk with you or chatter, I know like it comes from a nice place. Usually they're trying to be kind human beings and treat you like a human being. But if I'm like not in the mind space to do that, it makes me lose it. It's really, these are the little things that I feel like almost everyone that's been through almost any kind of cancer treatment could probably relate to. And outside of it, I imagine most people would be like, I don't really get, yeah, they're just being nice. What do you get over it?
Yeah, I do. I think about over the years techs that I've encountered and other medical professionals that aren't my doctors and nurses that have been so impactful just in the little interactions. But yeah, it's funny. And I feel for them. Like it has to be hard because every patient's different. And also every patient's different depending on the day. Like to your point, some days I might want to be really chatty, and some days I'm just like, I have so much anxiety about being here that I just want to see the doctor and I
Okay.
can't end right now. Yeah.
Yeah. Hey, while we're sharing neuroses around these experiences, I've got one that I just thought of, and I'm going to put it out into the universe because very few people know that I do this, and this is an opportunity to share this neurotic thing with the world. So there's a moment, so at this point, I've like literally lost count of the number of procedures I've had, either surgeries or ablations. It's a lot. And so I know the drill and I know the show up at 2 hours before, 3 hours before and check in at the and I know it's a whole day of procedural, do this, then do this. And the thing that makes me most nervous is not even the moments when I wake up, which can be their own kind of adventure. It's like the moments where I'm under anesthesia, but waking up like and not really in control and I'm not going to remember this. And makes me very anxious to feel like I'm going to be talking to these people and have no memory of it and say nonsense. And like, I know that the professionals don't judge you for that kind of thing, but it makes me anxious. I always like, you know how they do a timeout before procedure? It's a safety protocol. So everyone timeout. We're going to confirm the patient's name and their date of birth and what we're doing today. And I always use that just as a moment, an opportunity to like thank all of the people involved. They're all gathered around by definition, they have to be. Just like thank them for the work that they're about to do and for taking care of me. And I usually try to stop myself from pre-apologizing for however I'm going to be like when I'm in the operating room because I don't control it and I have no idea how I am. Like, so anyway, it's one of these things where if you just go in with blind faith that they're going to take care of you and that you're not going to, I don't know, that you're going to wake up and be yourself on the other side of it. That's another part of the whole picture.
Well, you do that. I'm sure that your team really appreciates that you do that.
They
You
always
know,
seem shocked, actually. And
yeah.
I've done it now, I think because I only started doing that a few years ago. So I've done it a few different times, and they're always, oh, they're not taken aback, but they're like surprised because they were
Right.
just getting themselves ready, doing what
Right.
they have to do to prep
Yeah.
the procedure.
I love that it's also like that you do it in a way that's like you're like, also may say anything.
It's very, I'm being very manipulative when I do it because I'm like, I'm going to thank you from the bottom of my heart so that when I, under anesthesia, act ridiculous, you'll be like, remember when he was nice and he said thank you?
Yeah.
Now
I don't
he's,
I don't think it's manipulative, but no, I appreciate that you do that. I'm sure that they do too. Yeah, I I definitely didn't have that foresight to do that for my surgery. I wish I would have, but yeah, and I think it's just also just I always try to just go, gosh, it's got to be really tough to work in oncology and it's tough to work in any medical field, but I imagine it's particularly challenging to balance not getting burned out and not losing your empathy, but then not getting overwhelmed with that empathy with patients. And it's funny, actually I flew home to New Orleans this weekend and was flying back. And I was in the airport. There was a woman that had on a nephrology nursing shirt that was like sitting next to me. And so as I got up to go board for my flight, I said, "Hey, I'm really sorry to interrupt," but just I noticed your shirt. I wanted to thank you for what you do because I'm a kidney cancer patient and had an nephrectomy. And so thank you. And she was like, "Oh, thank you so much." And you could tell she probably hasn't been thanked in a while. And not that we aren't appreciative as patients and caregivers, because I know that we are, but I think it's just nice sometimes to say that, even if you are trying to be like, in case I say anything crazy in surgery, I'm a good person, even if you have other motives as well.
I did have a great, to your point about there can be a really genuine, heartwarming interaction that comes out of this kind of thing. Like I was at a work event and like without just totally coincidentally ended up seated next to someone who works pretty high up at a company that years ago was involved, like intimately involved in in one of the drugs that I have been on, in the development of that drug. And the people, I don't talk very openly. I'm not keeping a secret. Like they can listen to this podcast, but I don't bring up my diagnosis at work. I try not to if I don't have to. And so the conversation with this individual, we were in a room probably full of like 30 or 40 people, but as we got into and I realized like he was like really pretty instrumental in the development of this drug that may or may not have played a role in extending my life to this point. I was able to actually thank him and shake his hand. I did it like almost in a whisper, but like I thanked him and I don't know how he felt about it, but I was like, what a privilege this is to be able to thank this person who I'm hoping like feels it, knows that the work, the hours and hours that he may have done when he could have been doing other things, like the efforts that he put in toward it and the 10,000 other people that it took to get that drug approved, to actually be able to thank that person, one of those 10,000 people, with from the bottom of my heart was really heartwarming.
That's incredible. I'm sure that he did appreciate it because, to your point, it drug development takes so much longer than I ever appreciated until I, became an advocate. That it does. I really consume people's lives, and they dedicate so much of their time, not just at work, but even outside, of like regular working hours, most instances. So I'm glad that you were able to have that interaction. I'm sure it was impactful for him too. As we're wrapping up, I just wanted to ask you, you've been so generous in sharing your story here, and what kind of takeaway or message do you want patients and caregivers and our other listeners to think of as they reflect on your story and kind of your message to the world, so to speak?
I think I'll go with two real takeaways, two take home messages. One is that one of those first ideas that we started with about being your own best advocate, because again, you know yourself the best and people aren't mind readers, and you have to at least make yourself known, your needs and your wants and your values known. And if you don't do it, it's going to be a lot harder for anyone else to do it on your behalf. So that's point number one. And point number two is that idea that we've also talked a lot about in terms of just living this very finite life with purpose. And I don't mean that in the cheesy way so much as like with deliberately, like choosing to do things deliberately because you want to, choosing to cut out things that you deliberately because you don't want to do them. That those two steps, you just follow them as guiding lights. They will bring you toward a life that really aligns better with your values than if you allow the inertia of your life to just carry you in some direction, which I think a lot of people fall into the trap of happening to them all the time. So those are changes I've made for myself that I've tried to stick to, and that's what I would hope folks listening might aspire to as well.
Live life deliberately. I'm definitely going to be carrying that with me from our conversation. Dr. Adam Stern, thank you so much for your time today. This has been an incredibly enlightening conversation that I hope that our listeners really take to heart. And thank you for your time, and thank you for all you do as a physician and a patient advocate and a regular dad and husband as well. I again want to thank Merck for their support of this podcast. And for more information, you can always visit the Judy Nicholson Kidney Cancer Foundation's website. We will be back next month with another guest. Thank you for your time today.
Thanks so much, and I'll be thinking of you during those scans. Thank you for having me.
Thank you. Yeah, fingers crossed. So thank you so much. Take care, everyone.